In a significant advancement for public health in Uganda, the Ministry of Health, alongside its implementation partners, has officially launched a malaria vaccine program in APAC district.
In APAC, malaria prevalence remains high. About 40% of children are admitted due to severe malaria.
Oh, but the good news is it is a disease which is preventable. So, ladies and gentlemen, let's embrace the new malaria vaccine.
The ceremony was presided over by the Right Honorable Robin Anabanja as the guest of honor on behalf of His Excellency, the President of Uganda, Yoweri Kaguta Museveni, marking a crucial milestone in the country's fight against one of its most persistent health challenges.
It gives me great pleasure to stand before you today as we mark a historic milestone in Uganda's public health journey, the national launch of the malaria vaccine into our routine immunization program. This is not just another vaccine introduction. It is a bold step towards liberating our nation from the heavy burden of malaria, a disease that has for long robbed our children of their futures, stained our health system, and hindered our social economic progress.
The launch represents a major step forward in Uganda's comprehensive strategy to combat malaria, which remains a leading cause of illness and mortality, particularly among children under 5 years of age.
Every single day, 16 lives are lost to malaria, with 10 of these being children under 5 years old. Last year, the entire year, APAC reported 41 deaths due to malaria. 4 children die every month. Compared to the national average, this is high because the different districts report either 1 or 2 deaths per month. APAC has the highest infective bites of 1,500 per year per person, which is 3 infective bites per night. The vaccine is free of charge in all public health facilities. It has already been paid for by the government of Uganda and Gavi. Do not pay for the malaria vaccine.
This vaccination initiative aims to substantially reduce the disease burden in high transmission areas like APAC, which has historically recorded some of its highest malaria prevalence rates in the country.
Malaria likes disturbing my child. You can go to the hospital either after a month or even sometimes weekly. Get us in the hospital, we treated her. We always treat her, but malaria cannot go back well.
When a child gets all the 4 doses of the vaccine, the chances of getting another episode of malaria is very, very limited. It's almost impossible to get another episode. So the encouragement is make sure that a mother, the caregivers, the communities encourage these children to get the 4 doses of malaria vaccine. And the doses are at 6 months, 7 months, and also 8th month. Then there is a booster dose at 18th month.
Uganda is the 3rd highest contributor of malaria cases in the world. And so many malaria control interventions have been put in place to reduce the burden of malaria, which have had a big impact. But they are not enough because even now, as of the last World Malaria Report, we have over about 15 million cases of malaria per year in the country. So there is need for other interventions, and malaria vaccines are definitely one of those important interventions.
Health officials present at the event emphasized that the vaccine will complement existing malaria prevention measures, including insecticide-treated nets, indoor residue spraying, and prompt diagnosis and treatment.
Malaria Consortium in Uganda, in collaboration with the Ministry of Health, has brought a new approach to control malaria in children below 5 years in the Karamoja region. We use a combination of drugs called sulfadoxine pyrimethamine plus amodiaquine, given to children during the peak malaria transmission season, that is from May to September.
Next Take Malaria is a revolutionary kit, and we call it an Eliminate Malaria kit. As well as we could detect malaria infections within the first 3 days or 72 hours of infection. For Next Take Malaria kit can detect that within the first 8 hours of infection.
This intervention will help to eliminate onward transmission of malaria parasites in our communities. So we are giving the best kits available for intervention in malaria fight.
These are called repellent plants. What I have today is just a sample, and we have over 50 in Uganda. This is rosemary, this is neem tree, this is called the night flower. Many of us have seen it here in Uganda in different parts, and it grows in any part of Uganda. We are encouraging communities to plant these, plus several other plants we have not exhibited here today, in order for them to fight malaria through prevention. Prevention is better than cure. Once you plant these plants, once you propagate them, they are very simple to propagate. Here in APAC, we have nursery beds which have been trying to promote them, but people don't know the purpose.
Prevent malaria.